My name is Dr. Washuka and I'm your host. Our topic is pre-eclampsia and we have Dr. Francis Were and he's an obs and gynae. Next is Jordana Bukusi. She is a person who had a baby and had pre-eclampsia. And next to me is Dr. Wills Wanjala, and he's from the alternative medicine world. We'll start with conventional medicine. What is pre-eclampsia?
Okay, basically, pre-eclampsia is hypertension in pregnancy. Well-defined hypertension in pregnancy basically is when the blood pressure is above 140 over 90. That is systolic 140 and diastolic 90. That is what we call hypertension in pregnancy. Now, to further qualify it, pre-eclampsia basically is presence of protein in urine in somebody who has hypertension in pregnancy. And hypertension in pregnancy can either be chronic hypertension in pregnancy. That means hypertension that is pre-existing prior to the current pregnancy, or it may be gestational hypertension. In other words, blood pressure that comes about during pregnancy only, and subsequently thereafter it goes away after about 3 months postpartum. Postpartum means after delivery. Let me make it very simple.
In layman's terms, high blood pressure before you deliver.
Yeah, high blood pressure before you deliver. That is what we call hypertension in pregnancy. But when we have protein in urine, then it now turns to pre-eclampsia. Pre-eclampsia. Eclampsia is actually simply means convulsions in pregnancy, which is the severest form of hypertension in pregnancy. So one may have pre-eclampsia, which normally occurs from around 5 months of pregnancy onwards, and pre-eclampsia can actually progress to eclampsia if not well managed. And usually eclampsia is actually a very serious medical emergency in our setups, and if not properly managed, it may end up with mortality. We may lose both the mother and the unborn baby.
Is it serious in Kenya? What's the percentage of Kenyans who get it?
Okay, around 10% of expectant mothers get hypertension in pregnancy. About 10%? About 10% of them. And we commonly find them among the extremes of age. The very young, who are maybe 20 years and below, and the more elderly ones, somebody who's over 40, 45, around that time, they're the ones who are prone to getting hypertension in pregnancy. And there are various factors that are attributed to hypertension in pregnancy, from family history, history of maybe kidney diseases, history of prior hypertension in pregnancy can also actually lead to hypertension subsequently in subsequent pregnancies. Yes.
Jordana, do you fit into any of those categories when you had your baby?
Yes, I think I was on the extreme age end because I was 21 when I was pregnant. So I was on the younger end of the spectrum where preeclampsia occurred. And then there's also a family history of high blood pressure as well.
There's a word that is coming up quite a lot, which is HELLP, HELP. What is that?
So HELP stands for hemolysis, elevated liver enzymes, and low platelets. So HELLP. This is a syndrome that tends to occur in mothers who have pre-eclampsia. Because pre-eclampsia basically is a syndrome. It affects all the organs of the body, from the brain, the eyes, the lungs, the heart, the liver, the kidneys, and of course the unborn baby, the passenger that is attributed to that. So it's a syndrome that commonly we are not able to diagnose clearly because the symptoms and signs of HELP are usually very vague, because the mother may come to you with just pain in the epigastric pain, pain in the stomach, or maybe some nausea, which is constitutional, or some headache. So to you, you may attribute it to just maybe the blood pressure. But when you actually go further and do tests, is when now you realize you're actually dealing with a more complex situation, where you're now having red blood cells being broken down, liver enzymes are elevated, and then of course platelets, which actually help in coagulation, are also sort of consumed.
Now, back to you. When you had it, did you feel all those things? Is there a term that you didn't understand, or
I felt nothing.
You felt nothing?
No, nothing at
so
all.
Then how did the doctors know that you had it?
My blood pressure was normal, stable throughout my entire pregnancy until my 37th week checkup. And then they noticed it was a bit higher than normal, so they just told me to keep an eye on it. I think it was maybe 140 over 80s. And then later on that week, actually, my daughter's father went to the emergency room, and I took him to the hospital. And so while we were there, I just asked the nurse, can you also just check mine, because the doctor told me that I need to be checking it. And then they checked it, and it was 150 over 100 and something. I don't remember the exact numbers. So at that moment, I just called the 24-hour doctor's line, and they said, where are you? I said, I'm in the hospital. They said, you need to go upstairs because we need to admit you, because that's insane. But I literally felt nothing. No, I was just at home watching TV, and I didn't know that my blood pressure was that high. I just felt normal. Yeah.
Dr. Is that a problem?
Yes, it's a problem. It's a problem in the sense that hypertension in pregnancy, or hypertension in general, sometimes may not have symptoms, like in her case. She felt nothing. She was quite okay going about her normal duties, actually taking somebody else to hospital, only to ask, as a by the way, that please just check my blood pressure, because I was told the other day my pressure is elevated. And then there she was with a blood pressure of 150 over 100 or 110. That is high, actually, because pre-eclampsia basically is when the blood pressure is maybe 140 over 90, we call that as mild. Then when it hits 160 over 110, then that is severe pre-eclampsia. Yes. Yeah. So she may have felt nothing, but something was going on in her body.
What do you think she should have done, because you are into alternative medicine, before she conceived, so that she doesn't have what she's having?
By virtue of how delicate pre-eclampsia is, I want to point out that it is important for us, alternative practitioners, to work hand in hand with conventional medics because of monitoring when that happens. But before that, most of the members of the public would approach us to assist them to conceive. And I find, now that I've come so close to preeclampsia, that the medication we provide before conception and during the first trimester tends to take care of that in the sense that we have medication that tends to preserve the pregnancy at the early stages, and therefore during the formation of the placenta and the new blood vessels, as the conventional medics will tell you, has tended to minimize the occurrence of such things, because we monitor our patients throughout their pregnancy until they conceive, parallel to prenatal care. So based on the medication we provide even before conception, that, according to our own research, has tended to reduce the occurrence of such cases. But I would want to take this opportunity to appeal to our conventional medical doctors to guide us and also work with us and actually publish what we observe, because the biggest challenge with the general public is probably lack of documented evidence of the role of alternative medicine in such fields.
After the break, the good doctor is going to tell us which predisposing factors are there to pre-eclampsia. So, viewers, see you after the break. Welcome back. Before the break, I asked what the predisposing factors are.
There are several predisposing factors for one to develop pre-eclampsia. And top on the list, we start with extremes of age. Yeah, that is the very young ones who get pregnant earlier than maybe from around 20 years backwards or 21 thereabouts or younger. They are more prone to pre-eclampsia. And those who are a little bit older, above 40 and above, they're also prone to pre-eclampsia. Then there's, of course, family history of hypertension. That can also predispose one to pre-eclampsia. History of kidney diseases, yeah, like those who have maybe chronic kidney diseases are prone to develop pre-eclampsia in pregnancy. Now, you might want to know maybe a little bit about how it develops from onset. Now, usually you find that the bridge between the mother and the unborn baby is usually the placenta. And in the early stages, when the placenta is forming, there are blood vessels which come from the mother, which actually invade they're supposed to invade the forming placental tissue. Yeah, so the spiral blood vessels are usually invaded by certain primitive cells, which we call trophoblasts. So these particular cells help to mold the spiral arteries so that they can have a high capacity to carry more blood to the placenta. So in that way, the mother's cardiovascular system will not have to overwork itself to try and push the same volume of blood into the placenta. So where this molding fails to occur, now the mother's body physiologically adjusts to now try and push blood with more pressure into the placenta. And as that happens, then what happens to the mother is that now the pressure gets elevated. So when the pressure gets elevated, then blood is forced into the small vessels. So not so much goes in, the baby doesn't get enough blood, and therefore that, as a consequence, affects the baby in terms of oxygenation and general growth. So back to the mother, this pressure affects her whole body system, from the brain to the eyes, to the lungs, to the heart, the liver, the kidneys, and of course, by extension, the unborn baby. Yeah, so it affects the whole body.
What can happen to the unborn baby if this is not treated?
If this is not treated, then number one, initially the baby may get affected in terms of growth. You may end up with a small baby whose weight may not be as expected. And number two, the high blood pressure will then eventually affect the baby and can even kill the baby in the uterus, even if the baby is at term like she had in her case. If no intervention is done and she gets a fit, or rather eclampsia, then if nothing is done immediately within 12 hours, then she may lose a baby, or even actually her life.
So, Jordana, were you aware of all this?
They told me once I was admitted because, like I said before, everything was fine. They had just seen my blood pressure spike, so they just said keep an eye on it. Don't do anything too strenuous. Don't stress yourself. So just be calm, sit at home, do nothing. But then once they told me that I was preeclamptic, then obviously I was nervous. But at least I was admitted, and I knew within the next 2 days my baby will be out, so she'll be okay.
With what the doctor is saying, there are certain things that you can do maybe to make the placenta form better with alternative medicines. What do you do in this direction?
With probably a combination of herbs. Actually, we don't use a single herb therapy on such issues. But like I've said, we are not focusing specifically on preeclampsia. But the medication we provide during the early pregnancy seems to mitigate the consequences of such developments. So you end up probably with a healthier placenta improved blood circulation during that time, probably standardized functioning of the nervous system, the entire system of the mother, without a specific focus on the embryo. We leave that for the experts.
If she's thinking of having a baby, when should she come to you? How many months in advance kind of sort herself out?
Normally, because of the nature of the activity of plant extracts, we advise 6 months in advance, because they would need to be on this kind of medication for some time, for a long period of time. And in the process, I want to repeat my emphasis on consulting conventional medical doctors for close monitoring, because we don't have the capacity to do hour-to-hour monitoring. When they develop preeclampsia, there are times when they need to be admitted. At that particular point, we, either by virtue of our legal framework, we have not reached the point where we can walk into the hospital and work together with the conventional medical doctors at that particular time. And therefore, it's important for conventional medic to be on call or present. But we will have done our part, and we are capable of also informing them what role we have played before. And I think if we were working like that, it would be easy for them to assess also the effectiveness of the sort of emergency intervention.
This close monitoring, when you were now fully diagnosed and you were just about to have your baby, just briefly tell us what did the doctors do?
Because my blood pressure was so elevated, the first thing they do is they hooked me and the baby up to machines to obviously check her heart rate, check mine, and then also monitor my blood pressure. So in the beginning, it was every 15 minutes that I was checked, what's your blood pressure, what's your blood pressure. So I just start buzzing every 15 minutes, and it actually continued to go up. There was a point in time, I don't remember, because they had started I was actually induced, so they had started the inducing medication, so I was actually out, and that made my blood pressure rise some more. There was a point in time where my mom said it actually shot up to 200 now over something. So then they put me on magnesium, which slowed my entire system down. So the lights went off, my blood pressure was fine. The lights come on, it shoots all the way back up. So when they put me on magnesium, then they were checking it every 5 minutes. So until the baby came out, my blood pressure was checked at least 3 times an hour. And then after she came out, they checked me once again, once every hour, it was still high, but it was coming down a bit now that the baby was out and there wasn't as much pressure on my body. So they did a good job of watching me.
Is there anything you'd like to add, Dr. Were, about the treatment? What would happen? How to have a baby with preeclampsia?
Yes, basically what we do is monitoring of an expectant mother starts from the time she conceives. And we normally start the clinics, or they start the antenatal clinics from about 12 weeks or about 3 months. And each time they come, there are 2 very important things we do, or 3 for that matter. We check weight, blood pressure, and urine for each and every visit, and that's mandatory. Because without that, you'll not know whether you're dealing with preeclampsia or not, because in her situation, she never presented with any symptoms. So if you check the weight, check blood pressure and find that there's a little spike, then you can actually ask the patient, or the mother for that matter, to rest a little bit for about maybe 15-20 minutes, and then check the blood pressure again. If you're not satisfied with that, then you can actually keep her around for about 4 hours. So if the blood pressure is consistently elevated 4 hours apart with 2 readings, then you obviously know you're dealing with elevated blood pressure in pregnancy. In which case, you will now try and grade and see whether it's mild hypertension in pregnancy or severe hypertension in pregnancy. If it is severe, then you might need to admit them for further monitoring and management. And when it comes to management of blood pressure or preeclampsia, we normally follow 5 basic principles. Yeah. So number one, the first and foremost is to control blood pressure with the use of antihypertensives that we use in pregnancy. Number two, we prevent fits, we prevent convulsions. And what we normally use now, which has been researched and proven to be effective, is magnesium sulfate, which she was given. Number three, we need to expedite delivery, okay? We need to expedite delivery. If for instance, in her situation, they found that the blood pressure kept rising as she was being monitored, then as the blood pressure is being controlled, and as we're also preventing fits, we also plan her delivery. And for a situation, they decided to induce her because after examining her and found that she was capable of managing a normal delivery, they induced her. Number five is to monitor the vital organs by doing the various tests to find out if the organs are affected. And the organs of concern, mainly in this case that we do tests on, are the liver. Like we said in HELP syndrome, the liver enzymes get elevated. Then we also check her blood. Is she having platelets? Because when she's having hemolysis, then she's also losing platelets in the process. And if that goes on, then she'll end up in a situation where she will have very little blood clotting factors. And should she go into labor, she may end up with severe bleeding, which can actually be life-threatening, okay? Then after that, then we prevent infection, because infection does occur and can occur in pre-eclampsia. And we do that by giving them antibiotics. So we follow those 5 principles to manage any mother who has pre-eclampsia in pregnancy.
Ah, nice. So it is important, as we've heard, to have your checkups regularly, because many mothers take it for granted. Oh, why are we going to see the doctor? Why do I have to go every month?
In fact, those mothers who've had babies before are usually the so-called experts in quotes.
Yes.
They are the ones who are very good at defaulting in terms of visiting the clinics.
Yes.
Because they feel that, why should I go to see the doctor at 3 months?
Yes.
I might as well go at 5 months or even 6 months. And for those, we have now a new way of handling them. We call it focused antenatal care.
Mothers with multiple pregnancies, many of them don't come to see the doctor. And viewers, actually, I'm one of them. When I had my first baby, second baby, by the third baby, what is the doctor telling me? So you don't go as often as you should. You're waiting for the pain to begin. So what's your take on that?
Yes, that is something we see commonly among the mothers who've had several pregnancies or several births for that matter. And they tend to come to the clinic either very late in pregnancy, or they just make one technical appearance. Yes, that at least I attended a clinic. But you see, that once is not enough. Because that once, by the time you come that once, maybe several things could have been happening to you and your baby. And so we still advise that despite the fact that you may feel that you know so much about pregnancy, it is important that at least you come to the clinic. And if you're not able to come as expected or as advised by the doctor, then we now have the so-called focused antenatal care, which we advise these mothers that at least try and visit the clinic 4 times in your pregnancy, at least 4 times. The 3rd month, the 5th month, the 7th month, and maybe towards the end, at least 4 times, that's good enough. Because in those 4 visits, if there was something going wrong with the pregnancy, we will be able to detect it. If you have hypertension, we will be able to detect it and assist you to get your baby.
So what would you like to say to all these mothers who don't want to go to see the doctor?
It was my first pregnancy, so I went to every single appointment, once a month, then once every 2 weeks. And it wasn't until the very end that I had this disease. So I suggest everyone just go. Because you don't know.
What would have happened if you had not gone?
I think that one was actually just God's grace injuring my daughter's father, because otherwise I was at home watching TV and I didn't know that my pressure was that high. I didn't feel a thing. It was just a normal day for me. So I think that one was just God's grace, because who knows what would happen at that point.
I want to say, because we also follow through the pregnancy, but we advise our patients to see conventional medics. So when they get back to us, they come actually with reports. For example, if they came to me complaining, because they probably find me to be friendly or something, and they want to inquire about something, then I say, we will need medical imaging. And so I will refer them to a conventional medical doctor who will do that. Then they get back to me with that report. Then I'll tell them, now, at this level, you will need to be either admitted or something, and therefore I hand you over to their able hands.
What do you say to all the women?
Yes, to all the women out there who are either planning or who are already pregnant, my advice to you is that it's very important that you be seen by a medical doctor, or if not medical specialists, if you are able to, because it's important that we check you from the word go, so that in the event that you have a problem with the pregnancy, we are able to contain it and help you to get a healthy baby whom you'll be happy about. Now, on the side of conventional medicine, we may not understand much about the molecules that they use, but we don't dismiss them because they are helpful. Because I remember when I was young, we would be given, those herbs. You're told this is good for you, this helps the stomach, and so forth. So we don't dismiss them because they have a role to play. All you need to do is maybe collaborate with them and do a bit of research so that we find out how these molecules they are using, how they work. Because if, like he said, that mothers who had preeclampsia or who have a preeclampsia, that they're able to give them alternative medicines and they're able to prevent, then well and good. Because on our side, we are able to find out what is going on. But sometimes it's difficult to actually prevent the situation where the spiral arteries fail to dilate. So if their molecules are working, well and good, because at the end of the day, we are there to serve the mothers.
Oh, thank you so much, Dr. Were, for telling us about preeclampsia. Thank you, Jordana Bukusi, for giving us your experience about what happened to you when you are having your little baby. And thank you, Dr. Wanjala, for telling us about complementary medicine and the herbal remedies that you do. And thank you, viewers, for giving us of your time and sharing this time with us. We are happy to have you, and we are happy that you listened to us. Thank you.
五花红色到处有，老虎豹子到处动，山门夫妇再打开，都是从那石门来。